Hello, everyone. Our presentation focuses on nurse burnout syndrome as a significant issue in healthcare leadership and management. The purpose of our presentation is to examine the factors that contribute to nurse burnout syndrome and mental health concerns, as well as the effects they can have on nurses, patients, and healthcare organizations. We will also discuss the important role that healthcare leaders and organizations play in supporting nurse well-being and creating healthier work environments. American Hospital Association did a survey about how nurses feel about their job and symptoms of poor nurse mental health. As you can see on this diagram on the right, 93% of nurses experience stress, while 76% feel burnt out, 47% have symptoms of depression, and 34% have experienced symptoms of anxiety. By the end of this presentation, we hope the audience will be able to recognize the impact that nurse burnout syndrome and mental health can have on professional nursing, patient outcomes, and healthcare organizations. We also hope to demonstrate why effective leadership strategies are important for promoting nurse well-being, improving retention, and supporting quality patient care. To begin, it is important to understand why this issue is so relevant in healthcare today. Nurse burnout syndrome and mental health are important issues in healthcare today because nurses continue to face significant workplace stress. Factors such as heavy workloads, staffing shortages, long hours, and the emotional demands of patient care can all negatively affect a nurse's well-being and job satisfaction. Burnout can also have consequences beyond the individual nurse. It may contribute to absenteeism, increased turnover, and nurses leaving their positions or the profession altogether. This can create even greater staffing challenges for healthcare organizations. In addition, nurse burnout syndrome can potentially affect patient safety and the overall quality of care. A 2023 study by Aiken and colleagues found that nearly half of the hospital's nurses reported high level of burnout, which was associated with increased turnover and concerns related to patient safety. Because of these widespread effects, nurse burnout syndrome is not simply an individual problem. It is also a major healthcare leadership and management issue that requires support and action from healthcare organizations and nursing leaders. With that understanding of why nurse burnout syndrome and mental health are such important issues today, we will now take a closer look at their impact on nurses, patients, healthcare organizations, and the nursing profession as a whole.
Nurse burnout is more than simply feeling tired or stressed after a difficult shift. As Lee and colleagues explain, burnout typically results from chronic workplace stress. Several workplace conditions contribute to this stress, including inadequate staffing and excessive workloads, long shifts with insufficient recovery time, and the emotional demands of caring for patients experiencing suffering, trauma, and death. Workplace conflict and violence, limited autonomy, and inadequate organizational or leadership support can add to this burden. The pathway on the right shows how these factors can build over time. Workplace stressors can lead to chronic occupational stress, which, when persistent, can progress to burnout. Burnout may then present as emotional exhaustion, cynicism, or detachment, and reduce professional efficacy. As Lee and colleagues describe, many of these workplace conditions are important antecedents of burnout in nursing. The effects can also extend beyond occupational burnout to anxiety, depression, PTSD, and psychological distress, which brings us to the mental health consequences of burnout. Burnout can extend beyond occupational exhaustion and overlap with significant mental health concerns. As shown on the left, these may include anxiety, depression, post-traumatic stress, sleep disturbance, decreased job satisfaction, and suicidal ideation. A 2025 study by Melnick and colleagues examined 501 U.S. nurses who were already considered at moderate to high risk for adverse mental health outcomes. The researchers found that burnout, anxiety, depression, and post-traumatic stress were each associated with greater odds of suicidal ideation. The study also identified several important protective factors. Nurses who demonstrated resilience, practiced healthier behaviors, reported greater job satisfaction, and felt that they mattered within their workplace had more favorable mental health outcomes. These findings reinforce that burnout is not simply a matter of feeling overworked. It can coexist with serious psychological concerns. And the work environment itself may either increase risk or help provide protection. This leads into the ethical, legal, and regulatory responsibility healthcare organizations have in supporting nurse well-being. From an ethical perspective, organizations have a responsibility to support nurse well-being and provide conditions that allow nurses to practice safely. This also means recognizing when problems such as chronic understaffing or excessive workload are systemic, rather than placing the responsibility for managing them entirely on individual nurses. From a legal and workplace safety perspective, fatigue, psychological stress, and unsafe working conditions can create risks for both the workplace and the healthcare environment. OSHA recognizes workplace stress as an occupational concern and emphasizes the employer's role in addressing recognized workplace hazards. NEOSH takes this further by recommending a system-level approach to healthcare worker well-being. This means looking beyond individual strategies, such as resilience or self-care, and addressing organizational factors, including staffing, workload, work design, psychological safety, and barriers to accessing mental health care. Ultimately, addressing nurse burnout requires both supporting individual nurses and recognizing the responsibility healthcare organizations have for creating healthier and safer work environments.
In a systematic review and meta-analysis entitled Nurse Burnout and Patient Safety, Satisfaction, and Quality of Care, published in 2024, nurse burnout was found to be associated with a decrease in quality and safety of healthcare, as well as an increase in patient dissatisfaction. Some of the financial costs associated with nurse burnout are due to patient falls, medication errors, an increase in nosocomial infections, an increase in adverse events, and a high rate of nurse turnover due to chronic stress. In a 2026 journal article, Karen Lasater and Linda Aiken, who are both PhD level nurses, conducted collaborative international research on adverse consequences of nurse understaffing through a global lens. They found that over the course of 15 years in Japan, actions have not been taken to create policies that increase nurse staffing, and that preventable deaths and unrealized cost savings due to higher than necessary length of stay and readmission have persisted. They note that strong scientific evidence supports minimum safe hospital nurse staffing requirements, which are already in place in Queensland, Australia, British Columbia, Canada, and in the US states of California and Oregon. Policies at the hospital level, state level, and federal level often view nurses as a cost that must be reduced instead of a high value investment. And there's reluctance by policymakers at all levels to establish minimum safe nurse staffing requirements to improve patient outcomes and decrease nurse burnout, which is an area that we can help to engage and make changes. The nurse in this photo is Cami Robinson, and she used to work in an emergency department and became very burned out after a period of time. A friend told her about Roundup River Ranch, which is a camp that creates a medically safe environment for kids to come. And she found her home there, and she's finding a lot more joy in nursing.
Leadership and nursing managers hold the responsibility of sustaining their team's well-being. Leaders can address nurse burnout through their leadership style, appropriate nursing, resource allocation, and communication with their teams. By prioritizing staff well-being and maintaining a healthy work environment, nurse leaders can help prevent burnout and build stronger foundation for nurses to provide excellent patient care. All leaders and managers have their own approach to the manner in which they lead their team. The American Nurses Association categorizes leadership into 7 different styles. We will be focusing on democratic, transformational, autocratic, and laissez-faire styles. The democratic leaders place a strong focus on teamwork to promote success, but they are less impactful when working independently. The transformational leader encourages their team to optimize efficiency and productivity, and they prioritize nurses' personal development. The benefits of democratic and transformational styles are that they focus on communication and collaboration of the team. This can boost team morale, promote personal fulfillment, and improve the overall workplace culture. The autocratic leader does not ask their team for input. They make decisions on their own, but they can be dependable under pressure. The laissez-faire leader is the opposite of autocratic, as they tend to rely heavily on their team. They require an autonomous nursing staff to function. With both of these leadership styles, the nursing team could feel unvalued or pressured. They would not have trust in their leader, and the team could have stagnant output. This would all lead to severe burnout. Ultimately, the ANA reports that to be a good nurse manager, a leader must have a fierce dedication to helping their team succeed. They can show their leadership qualities through clear communication, supporting their team, adapting to change, and embracing continuous professional growth for themselves as a leader and for their team. Nurse managers can ensure that they are staffing their units appropriately. They can also implement scheduling models that support a healthy lifestyle to promote work-life balance and improve job satisfaction. For instance, working fixed schedules rather than non-fixed rotating shifts is associated with reduced stress levels, better sleep quality, and healthier eating habits. Leadership and managers can promote well-being within the nursing staff by normalizing the utilization of their paid time off. Sometimes hospitals will have a cash-out system where employees who have too many vacation hours can get the hours paid out rather than actually taking a day off. This would be helping with staffing coverage, but it would be harmful for the employee in the long term. Using PTO can help nurses to maintain a work-life balance and prevent burnout. Leaders should also motivate their staff to actively take their lunch breaks at work. Other nursing leaders, such as the charge nurse or patient care leader, can promote well-being in their team by promoting a balanced workload within the team. A charge nurse could help make assignments based on the acuity of patients and take into consideration the level of experience of the nurses. Charge nurses will also be helpful to their staff by stepping in to help when the other nurses need a hand or by making assignment changes if needed. Nurse leaders must also have strong communication with their teams. They can encourage the nurses and other staff on their teams to prioritize their mental health. Leaders should equip nurses with the tools to complete self-screenings and to seek help in their organization or with other mental health professionals if they need it. Nurse leaders should have an open door policy and destigmatize depression, anxiety, and stress so that their team members will feel more inclined to voice their concerns and ask for assistance. By recognizing early warning signs of changes in their staff's performance or mood changes, nurse leaders can prevent nurse burnout or other mental health symptoms like suicidal ideation. For instance, if a nurse is showing more signs of fatigue and stress on the job or through absenteeism, a nurse manager could open the line of communication with the individual to see if they could help them in any way instead of making assumptions and moving directly to punitive discipline. The following words by trusted and colleagues can serve as a guiding principle for leadership to address nurse burnout. By investing in the well-being of nurses, we are investing in the healthcare of future itself.
Burnout has serious implications on the professional nursing practice. The World Health Organization revised the concept of burnout in the 11th revision of the International Classification of Diseases, or ICD-11, that took effect in 2022. Burnout was no longer classified as a medical condition, but as an occupational phenomenon, explicitly describing burnout as a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. This change indicates that it is a real experience that prompts people to seek healthcare. To be diagnosed with workplace burnout, there must be feelings of energy exhaustion, increased mental distance or cynicism related to one's job, and reduced professional efficacy. Levels of occupational stress are elevated for nurses due to their unique work. Two major factors include shift work and unpredictable changes in patient conditions. Shift work, especially rotating or night shifts, disrupts circadian rhythms, reduces sleep quality, and can lead to fatigue, decreased alertness, and impaired decision-making. This is compounded by as-needed scheduling, unexpected double shifts, and unpredictable on-call work. Long hours and limited control over schedules also contribute to instability in work life. Secondly, nurses must always be aware of unpredictable clinical situations. This requires constant vigilance, quick decision-making, and emotional resilience. Exposure to human suffering, death, and traumatic events is also common and can lead to emotional exhaustion and burnout. A 2025 study by Lee and partner authors attribute burnout to 5 core factors. Emotional exhaustion is a depletion of emotional resources due to excessive work demands and constant occupational stress. This has been identified as the most noticeable factor for nurse burnout, with research indicating an association with staffing shortages and high patient-to-nurse ratios. Depersonalization involves nurses detaching themselves psychologically from work to conserve emotional resources, leading to a loss of professional idealism, development of impersonal attitudes towards patients, and a cynical perception of one's work. Nurses may shift from a professional commitment to one of meeting the minimal work requirements and ultimately weakening their professional identity. Reduced personal accomplishment refers to a diminished sense of self-esteem and professional competence in nursing practice. This leads to a diminished professional commitment to the organization that they work for. Meaning depletion involves nurses no longer perceiving their work as possessing meaning. This is heightened through repetitive tasks, a top-down hierarchical structure, and insufficient recognition. This leads to disengagement. Lastly, somatic complaints are common symptoms reported by nurses, including sleep disturbance, chronic fatigue, musculoskeletal pain, tension headaches, and GI problems, interpreted as bodily warning signs that signal occupational stress. These identified factors lead to organizational insufficiency, including decreased job satisfaction, negative correlation to organizational commitment, and reduced work productivity, which leads to process inefficiency, nursing service quality, and an overall negative impact on organizational performance. Organizational withdrawal behaviors involves nurse turnover, with nurses who report high burnout scores having higher rates of turnover intentions. Organizations also report a higher rate in absenteeism, which then poses the threat of operational stability. Nurse burnout syndrome extends beyond the nurse's individual emotional exhaustion to directly impact patient quality and safety. Studies report significant correlations between nurse burnout and poor patient safety climate and grades, hospital-acquired infections, falls, medication errors, increased adverse events, and low patient satisfaction. Lastly, mental health deterioration is a consequence of burnout. Burnout is a risk factor for anxiety, depression, PTSD, and various other mental health problems. This indicates the need for early intervention and prevention. To conclude, the research presented consistently demonstrates that nurse burnout syndrome is a risk factor that impacts not only the individual nurse, but the healthcare organization too. Nurse burnout places nurses at higher risk for anxiety, depression, emotional exhaustion, and other serious mental health concerns. The organizations are at risk for higher turnover, patient safety events, and lower quality outcomes. Therefore, nurse burnout should no longer be viewed as an individual problem. Recognition by leadership is key. Leaders need to instill multidimensional approaches that enhance nurse well-being while ensuring safety and improving quality of care. Financially, leaders need to recognize nurses are a high-value investment and not a cost. Leaders also need to leverage social support programs. Leaders need to have ethical, legal, and regulatory responsibilities to address the physical and mental workplace hazards, provide the required breaks, and comply with written staffing plan requirements, and keep quality and safety as the strategic priority. Leaders should champion peer-to-peer or direct leader check-ins with their employees at least annually, and more often for newer employees. And lastly, leadership needs to continually endorse research to assist in developing learnings and create evidence-based practice that will support nurse burnout.